Well, good afternoon and welcome to the City of Toronto COVID-19 media briefing for Friday, November 20th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory.
Well, good afternoon and thank you, Brad. Today, the province of Ontario announced further restrictions for the City of Toronto and Peel region to help stop the spread of COVID-19. I want to thank Premier Ford and his cabinet for listening to public health officials, their provincial officials, and our local medical officers of health, Dr. de Villa and Dr. Lowe, and proceeding to implement these measures. I believe our cooperation with Peel in the face of a similar serious COVID challenge will make it easier for the public to understand these new initiatives in this region. We ask the province for further actions because the numbers continue to go in the wrong direction, despite the City of Toronto having the strictest existing restrictions in the province. As a city, we put extra measures in place some time ago to fight the virus because we thought it was the right thing to do. Not the easy thing to do, but the right thing to do. The request for some of the further action we thought necessary, even after we initiated additional actions and measures of our own, was made by way of a letter sent earlier this week, and since then, even since then, we have seen case counts increase, we've seen hospitalizations increase, and tragically, more people have died from this virus. Today, we've also seen very grim projections from the Government of Canada that show without further interventions like this one announced today, COVID-19 could spread like wildfire right across our country. We have to stop this virus now to save lives, protect our most vulnerable, and ultimately to protect our economy. That's why I support the provincial measures announced today by Premier Ford. We can't have a healthy economy and build back better if people are sick and continue to get sick in greater and greater numbers. The people who are getting sick are employees, they are business owners, and they are the customers of those businesses. We simply cannot have a healthy economy without healthy people. And while I know it would be great if we could just rely on everyone to do the right thing and not have further mandated restrictions, our public health officials are clear that real progress in fighting the virus and real change in our numbers will only come with toughening up the rules, as has been done today. The case for action to stop the spread of COVID-19 now, before it gets even worse, is clear, and that is why we are seeing further action today from the province, which we think is the right thing to do, just as we are seeing strong action by other provinces across Canada as they all grapple with this deadly virus, as we're having to do. These restrictions are being put in place to save lives, to keep people healthy, and to protect the healthcare system. I know that many of these measures will be challenging for many of our residents in the City of Toronto and elsewhere. I know they'll be difficult for many in this community, for example, who find faith and community by visiting a place of worship. But I also know that many places of worship, for example, have already begun offering virtual or drive-in services for the health and safety of their members, and I would encourage as much of that as possible in the weeks ahead. I also know that all of these health measures will result in some additional hurt for some hardworking people and for many hardworking businesses. And I say additional hurt because they've suffered a lot of hurt already. They are innocent victims of this pandemic, which is why we have worked hard to secure the Government of Canada's very welcome support for things like rent and wages. I know Deputy Prime Minister Freeland is working as hard as she can to make that financial relief available as soon as possible to the affected businesses now that that bill has finally received royal assent. And I understand that they're receiving applications momentarily. And that is also why Premier Ford today announced that the province is doubling its supports for businesses impacted by these measures, adding an additional $300 million now for a total of $600 million. And so I want to thank Premier Ford, who I've spoken with twice today, and thank Finance Minister Rod Phillips for this additional support to help businesses who are struggling. I will work day and night to make sure that those affected businesses get help and to make sure that we stop this virus so that business can be safely carried on going forward. The alternative to the actions being undertaken today, in my view, would include a broader and much longer period of restriction, which would cause much more economic damage and which would likely end up being implemented due to far worse health conditions than even exist today. We just don't want to go there. We don't want to go down that road. That is what will happen if we don't act now. We're also working to make sure that we expand our targeted COVID response and support in areas of this city, our city, where case numbers are higher, including in particular the northwest of the city and northeast Scarborough. While citywide restrictions are necessary to reduce the number of people we all come into contact with and to reduce the likelihood of COVID-19 spreading, we know that they must be implemented alongside enhanced supports to protect frontline and essential workers and other people who are struggling. And these measures must help us to target specific support to the areas and the people who've been hardest hit. Those hardest hit need more help, period. This must include even more and more accessible provincial testing, which we are taking up with the province. It has to be closer to the people, and we are doing whatever we can and will do whatever we can as a city to cooperate with the province in making sure that this happens, that we have more testing, more accessible to the people who need to be tested. The City of Toronto is working closely with our federal and provincial government partners to expand supports for our most heavily impacted residents, and we will have more to share with you in the coming days on that matter. City officials are also working now to provide people with a plain language guide to what they can and cannot do under the updated measures. I know the vast majority of people want to follow the rules and have been trying to follow the rules, and we just need to make sure that we explain them as clearly as possible. I know it can be confusing. It can be confusing for people who live and breathe this every single day. The simplest way I can describe what people need to do right now is this: please stay home as much as possible. Please stay home as much as possible. There are fewer places to go now, but please stay home because it is the right thing to do. It is the right thing to do, to be with the people that you live with. You know, there's a song that's "Love the One You're With," but it was written in a different context. But love the people you live with and love spending some time with them and doing things together, but please stay home. Go shopping once a week, just for essentials. While you're staying at home, it's okay to go outside and get some exercise and fresh air, but please do it only with the people that you live with. When you're out, wear a mask and wash your hands. If you possibly can, please work from home and study at home. And if you're sick, please get tested and please stay home until you get better. Now, all of this also means anticipated cooperation from as many employers as possible, especially the larger ones, in assuring employees that if they get tested and if they test positive, their jobs and their paychecks will be protected. That's very important to a number of these people, and it's acted as a deterrent in their own minds from them getting tested, and it means they often go to work with symptoms and go to work and spread the virus inadvertently. This is a tough time for our fight against this virus, but we are going to get through this and get to the day in the not-too-distant future, as we've heard hopefully this week, when we have a vaccine to help us fight it most effectively. And so while I know the coming weeks, which are normally a fun and festive time of year for many, many people, are going to be rough for everyone, there is hope on the horizon. We cannot give up that hope, and we most certainly cannot give up the fight against this virus. We all need to stay home as much as possible right now and follow the rules in order to protect each other. I'd now like to ask Dr. de Villa to provide her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As Medical Officer of Health, I can assure you that there is no doubt that today's decision by the province is the necessary decision. It is demanded by the high level of the COVID-19 threat and demanded by the great risk we will lose control of viral spread. Today, we reported another 420 cases of COVID-19 in Toronto. The total number of cases in Toronto since the pandemic started is now approaching 37,000. Just from October the 1st through to today, we have reported 16,630 cases of COVID-19. So 45% of all cases so far have occurred since the beginning of last month. We must act firmly to disrupt COVID-19 and its ability to threaten and harm us. We know we can turn these numbers around. We also know what happens when the virus spreads out of control. We're seeing it now in the United States and in Europe. This is not what I want to see for Toronto. I don't want to see hospitals straining to care for too many people with limited space to provide that care and limited treatments for the sick. We've already lost more than 1,500 lives to COVID-19. I don't want to see deaths in our city numbering in the higher thousands, having doubled or tripled or worse. I don't want to see people struggling with the long-haul fallout of COVID-19, breathlessness, coughing, fatigue, forgetfulness that can linger for weeks or for months. I don't want to see any of this for our city when there are things we can do to prevent it. To stay healthy, we have to be able to keep apart. But there are people who struggle to do that for lack of choice. They have to go to work. They have to pay their bills. They've probably not had the kind of job that gave them much chance to put money aside for a rainy day, let alone a drawn-out pandemic. That is why I'm adding my voice to those urging senior levels of government to find ways to support people practically through the next few weeks, in part because it will allow more people to stay safely at home, and that will help reduce and prevent the spread of infection, which is why we're doing this to begin with. So let's be disciplined about keeping apart in the next 28 days by limiting contact with the people we don't live with. Now, for frontline workers, whether in healthcare or in the essential services sector, we know that your work requires you to have contact with people you don't live with. That's why, in addition to workplace safety measures, we're calling for enhanced supports to keep you as safe as possible. Everyone has different needs and requirements, but going forward, for those of us who can choose, please choose wisely. Please choose to keep at least 6 feet or 2 meters apart from people you don't live with. Please choose to wear your mask when you're exposed to people you don't live with. Please choose to wash your hands as frequently as possible. And please choose to stay home and stay apart as much as you can. If you resolve to keep out of COVID-19's way, you'll deprive it of the chance to keep spreading at these dangerous levels. For now, that means keeping apart from those we want to be closest to. No excuses, no exceptions, no just this one time. Because letting our guards down has undeniably played a part in bringing us to this moment. Keeping a distance from one another will prevent the virus from spreading and will move us closer to what we all want: life in good health, life in close contact, life without worry about this virus that has changed our lives. So if we've got to do this, and there is no doubt that we do, let's make it work. I'll now turn it over to Brad.
Thank you, Dr. de Villa. Before we go to questions, just a reminder to reporters that you will need to unmute yourself on WebEx. So our first question is from John Chidley-Hill from the Canadian Press. John, go ahead.
Good afternoon to both of you. You both spoke about how challenging the next 28 days will be for Torontonians. I'm curious, for you two, what will be the biggest challenges facing you in your respective offices?
I would say for me, it doesn't change. It's trying to make sure that, the city continues to function and that, people can continue to live in the city and be supported in the way that they need and that they expect. And secondly, that we can try to make plans for when we are coming out of this to make sure that we can get the city back on its feet, because we keep going through these cycles, where, and they're almost as damaging as the period we're about to go through itself, where it's the cycle of sort of opening and closing and people being employed and unemployed and numbers going up and down and so on. I think but we have to support people, and I think that's going to be the biggest challenge we have. And the more that you close things, the more that you have these restrictions in place, frankly, the more people who need support of one kind or another. And so I think that will be the biggest challenge that we face, and then getting ready for not just the sort of the promised day that lies ahead in 2021 when the vaccine is present and people are starting to be able to avoid the virus in that way, but rather just preparing for the much shorter term reopening that we need to have, and it's a big task to do that.
Yeah, from my perspective, what can I say? But there's been no shortage of challenge that COVID-19 has presented to us, certainly in local public health. But that's clearly a challenge that's been presented to public health officials and authorities all over the world. So the continuing challenge will be providing the best and most effective response to COVID-19, and as the Mayor rightfully speaks of, making sure that that includes the supports that people need, given the very difficult circumstances that many of us find ourselves in. There are financial challenges, social challenges, mental health and other health challenges that have been presented throughout the entire pandemic thus far, and I expect that that will continue for some time. So we're going to continue to provide the best response we can and adapt and try to, take care of the patient that we have, all 3 million patients, in fact, here in the City of Toronto as best as we can at Toronto Public Health.
A follow-up for you, Mayor Tory, a slight change of gears. Earlier today, the Toronto Raptors announced that they're going to start their NBA season in Tampa. I know you're a sports fan. How do you feel about that news?
Well, it's disappointing, but it's understandable. And look, as mayor, and I'm sure I speak for every resident of the City of Toronto, we will support the Raptors no matter where they're playing, because they're our Raptors, and Tampa Bay shouldn't get any ideas in that regard. They're our Raptors, and they will be our team. And now we're going to work hard with public health and with the Raptors and everybody else to make sure that I think there's a provided for time when perhaps in the spring or late winter we might be able to get them back here. And so if we could just get this virus, if people would just get on board, we get this virus wrestled to the ground, there'd be no problem getting them back. And we want them back, and they will be back, and they're going to win.
Okay, thank you. We go next to Matt Bingley from Global News. Go ahead, Matt.
Hi, good afternoon. I'm just wondering, Dr. de Villa, on Monday, or sorry, rather Wednesday, you talked about that letter, but would not say what it was and the restrictions that you were actually asking the province for. Can you tell us if everything that you were asking for has actually been provided, or if there is any gaps that you think that you'll actually have to use your own powers to address?
Well, Matt, I think I can tell you that it's clear that the province certainly heard our calls for serious measures to be put in place and took seriously the need to reduce the likelihood and to reduce the circumstances that give rise to virus spread, places where people gather together in close contact, especially without a mask. I would suggest, though, that there are other supports that are required, because we know that some people live in circumstances that frankly make it very difficult for them to comply, to adhere to public health advice. There are people who need supports to be able to stay home when they're sick. We know that there are people in our city that continue to have difficulty when it comes to isolating when they find themselves in the face of a COVID-19 diagnosis because of concerns around their financial viability. So those kinds of supports need to be put in place, and we're in active discussions with the province to ensure that we're doing the best we can, not only in Toronto, but ideally throughout the province, I would say, to make sure that we have all the measures and all the supports in place so that we can bring this virus under control.
And just to follow up to Mayor Tory, it sounds like in that letter, just based on the way that you're speaking about those supports for lower income individuals, it sounds like that was requested. Can you just say how, is it not reckless for the province to have this plan without any of those supports laid out, especially considering what we are seeing in the northeast and the northwest of the city? Concerning virus spread?
I think what's really fair to say is that thus far, the two governments have actually been quite responsive to requests that we have made for additional supports in a number of different ways, and that this list was submitted more recently, and we've even been taking the opportunity this week while we've been waiting to see what they were going to do to flesh out that list and exactly what we can be doing as a city with their support to help people who need help the most. And so I think it is very premature to conclude they're not going to provide us with this help. In fact, I think that there's every reason to believe they will. I've had offers of help from ministers that I've talked to at both levels of government, specifically on the kind of thing we're talking about here. So, I think we'll get to work on that right away. We have been already, and I think we'll have more to say about that next week.
Thank you. We'll go next to Angelina King from the CBC. Angelina, go ahead, please.
Hi there. Thanks for taking questions. Wondering if, Dr. de Villa, you think that this was the right time for the province to announce this lockdown, or do you think it should have been done earlier?
Well, I think we should commend the province for taking the necessary step. Clearly, we want to control virus spread, and we've seen what can happen if appropriate measures aren't taken. So, I'm glad they've taken the steps to provide, the necessary measures to limit the likelihood that people congregate in close contact with each other, especially without masks. And I think it's now beholden on all of us to do our part, to work together as we have done before, and I know we can do again, to stay home as much as possible, reduce our contact with people that we don't live with, so that we can get on with life, hopefully with this virus behind us.
Can I just add to that? I often will tell people the story of when I used to work for the late, great Ted Rogers, and we had this circle that we always used to know we were confronted with, where the quadrants of the circle were too early, too late, too little, and too much. And in order to satisfy him, you had to have the dart land right in the dot in the center of the circle. And there is no such way to end up in that place. And the bottom line here is that the Premier and the Government of Ontario, in partnership with us and people from Peel and elsewhere, had the courage to do today what is the right thing. And now we can move forward, and it's going to cause a lot of hardship for many people, but I think in the end it's going to be better, because we're going to be in a better place at the end of this period in terms of dealing with this virus and actually protecting the economy and protecting healthcare and protecting people's lives. But it's almost impossible to know exactly what the right time is or exactly how much to do on a given day. You do your best, and that's what everybody's been doing, including us and including the Premier.
You have a follow-up, Angelina? You have to unmute yourself. Go ahead.
Yes, just wondering, is the city's plan for enforcement going to change at all with this to ensure, people are lining up for curbside pickup 2 meters apart? People aren't gathering with 11 people outside, or they're not with people not from their household?
We spoke this morning about the challenge of enforcement all the time, because, it's a great big city with thousands of places and businesses and millions of people. And we couldn't possibly have enough people to be going around checking every lineup or checking every store opening. And so I think what we're going to have to count on is basically, I think the best way to ensure enforcement is if people just stay home, as we've advised them to do, except when absolutely necessary to go out. And otherwise, we will have our people that are going to be, as they have been, going around and monitoring what's going on in the city and responding to complaints. And, the fines that are provided for are quite stiff, and I hope some of those actually, I hope they don't have to be handed out, but I hope if people are transgressing that they will be given those fines so that people will know it's serious. But it's not realistic for us to sort of say that every single, street corner is going to have somebody on it from the licensing authority or from the police department to watch this. We're just going to have to rely on people to do their best to comply, which I know most people have been doing, and now we need even better efforts from those who've been a bit slow to get in the game.
Okay, thank you. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead, please.
Hi there. Now that the cat is out of the bag, I'm hoping there'll be no caginess, and you can both say what is different in what was announced today versus what was in the letter. What is either more or less? How is it different than what you asked for?
So, David, we asked for a number of measures really focused on reducing those opportunities for people to gather, and I think that you can see that the province has taken that request seriously. As you've heard us speak to, there are some other supports that are important as well in order to facilitate people's ability to comply with good public health practice and to comply with the necessary kinds of actions that must be taken to reduce virus spread. Things like making sure that people have supports so that they can stay home when they're sick, or that they can take time off work should they find themselves, facing a COVID-19 diagnosis and a positive test. So I think there are still some areas that we're working on together, and we look forward to having some success, as you've just heard the Mayor say, on those aspects of our requests and what we think is necessary in order to reduce COVID-19 transmission in our city.
Okay, the follow-up is there's some things like banning large weddings that make perfect sense given the number of infections we've seen. There's others like banning outdoor patio use for restaurants and also haircutting, in which please tell me if there have been significant infections with either of those that would warrant a clampdown on them now.
Sorry, so David, you're asking about infections with?
With outdoor patio dining for restaurants and also haircutting. Is there science or data to back up curbing those now?
So there is data and science that supports the more we are able to limit the likelihood that people congregate together, particularly with people that they don't live with, the better able we are to reduce the spread of COVID-19. And I think that it's important that people realize that even though the risk is lower in outdoor settings, it doesn't mean that it's zero, particularly in those events where people get together in a very relaxed environment with friends and family, even when that is outdoors, and particularly when we're talking about activities that don't involve the use of a mask or where it's difficult to wear a mask. Things like sharing a meal together or having drinks together, as would happen in a restaurant, whether it's indoors or outdoors. So that certainly is there in the literature and has been seen in experiences here in Ontario, here in Toronto, and all around the world.
Okay, thank you. Last question is to Scott Lightfoot from CTV News. Scott, go ahead.
Thanks, Brad. Question for Dr. de Villa. How will this differ from what Toronto went through in March? I'm guessing that public health has learned some things about this virus over the past few months. I'm thinking about playgrounds being closed, that kind of stuff. But what's different this time around from what we experienced in March?
Well, I still have to look at all the details myself, so I'm not able to give you a fulsome response. But I will say this, you're right. We have learned quite a bit since March, and I would say that we are still learning. This virus continues to evolve, and our learning continues to evolve in and around how best to limit its spread and to reduce its transmission. What we do know is that as much as possible, when people actually stay apart, right, from others with whom they do not live. So stay at home as much as possible. Minimize contact to the greatest extent possible with people we don't live with. Then we know we can actually be very successful in terms of reducing its spread and minimizing the impact of COVID-19 on our community. We also know that we need to get on it quickly, and the faster, the quicker we are able to reduce the spread, the sooner we can get back to, other activities, and the sooner we can get back to life a little more similar to what we knew prior to COVID-19 being part of our lives. We also know that we want to do our very, very best, and there are many things that we can do, quick action, that actually supports healthcare and the ongoing capacity of our healthcare system to provide important care. So I think these are the kinds of lessons that we're putting into place, that we're using this time around in order to reduce spread and to try to manage as safely as possible, despite the fact that we have COVID-19 in our community.
Scott, if I could just add to that, and it really just amplifies the point that Dr. de Villa made. We spend a lot of time talking about what's different and what's different in the red plan and the green plan and the stage 2 and the stage 3. Maybe the important thing to focus on is what's the same. And what people were asked to do in the spring, which they did, I think then because they were afraid of the unknown, which is they stayed home. They stayed home. And we're asking people now to stay home. And maybe because they still have a fear, which is a healthy fear they should have, but also because they understand better the contribution that can make, and that, frankly, it's not that bad to stay home. I mean, it's not ideal. It's far from ideal, but if they think, as I think they should by now, that it's going to make a positive difference, the biggest positive difference above and beyond all of these other rules, then if they please would just stay home, that's going to be the same as it was in the spring. And in the spring, it actually helped us to bring the numbers under control, as it will do again if people stay home, wear a mask, wash their hands, and keep away from other people, frankly, even the ones that they would love to spend more time with.
Follow-up, Scott?
Thank you for that. Yeah, Mayor Tory, I think it's fair to say that this announcement today will be the death knell for a number of local businesses and restaurants that have done whatever they can for the past 8 months to hang on. Basically a month from Christmas, they're now in this situation. I mean, you referred to them as innocent victims of this pandemic. I'm sure you've spoken to lots of them. So what do you say to them? What is your message to those people who have learned this today and realize that from a business sense, they can't go on?
My message, I don't know, you don't even know what to say, because I have spoken to many of them and I've heard from many of them, and saying I'm sorry implies that we're doing something wrong. We're actually trying to do something right, which is to make sure that the society we live in here, the overall health and well-being of 3 million people for which we're responsible, the economy itself can be in a position where it can come back. I've repeated often today that a healthy economy requires healthy people. And if we let this get to the stage where all the business owners, all the customers, and all the employers were getting sick, the employees were getting sick, then we're not going to have the ability to have a properly functioning city where people are in a state of good health overall, including their mental health. So I am terribly sorry about this in the sense of having a deep regret that these decisions have had to be taken. And I know the Premier feels the same way. I've talked to him today twice and many times over the preceding weeks. And there are people who suggest we kind of just make these decisions in a cavalier fashion and just say, oh, well, I guess that's just the way it goes, and that's the price that will be paid. It's deeply troubling to be a participant in making these decisions and to hear the advice as to what we can best do to shut this virus down. But it's still the right thing to do, and we will recover. This city will come back. The business community will come back. The city and the business people and all the other people are too good to keep down. But we've got to get the virus down on the ground first. And that's what this is, the best way that everybody seems to know as to how we're going to be able to move in that direction and get to the place where we need to be with the vaccine coming so that we can have much better days in 2021.
Thank you, Mayor Tory. Thank you for joining us. That concludes today's briefing. Please stay well, everybody.